And when you're working with animals, kind of how much of the PEMF is guided by observation and feedback rather than like fixed protocols?
All of it.
Yeah.
I mean, all of it. I mean, you have to learn, you have to understand. I always say, if you're going to do the first session with the horse, like make sure the owner or trainer is there. Cause the horse is going to react. And first of all, the owner and trainer is going to be amazed at the way the horse reacts and the way the horse feels. All the times I have been in barns. I mean, so many times the trainer's been like, this one's really mean. He's going to bite you or she's going to bite you. She's ornery, blah, blah, blah. Well, a lot of that comes down to pain, right? And so when I go in, I'm like, okay, that's fine. And I'm going to steer clear, but I'm going to do the sessions. And by the end, they're laying on, like I have a horse literally putting their head on my chest. And this is always amazing for the owners and the trainers to see because they're like, what? Well, you have to be able to read the animal. Sometimes they'll push themselves into you and people at first are thinking, oh, he doesn't like it. He's moving away. But in reality, he wants you to move the coil down or up or over wherever it feels good. So reading the animal is really important. In small animals, particularly dogs and cats, they know when they want it, when they don't want it. Horses predominantly always want it. Like I have never had a horse that has not been excited to see us. But when it's small animals and small animals, they'll come up and get in the coil and lay down on the machine. And when you turn it on, even when you're doing it, they'll come and sit in your lap. They want it. And then if they're not interested, they're going to walk away. And it's it's their unique relationship with the magnetic fields of the earth and their body that they know when they need it, when they don't. So you don't want to force an animal to get a session if they're not responding positively to it. Very rarely does that happen, but if they get up and walk away, let them.
Yeah. And it's a really important point you're making, actually, because we get so many people with the feedback, like they bought a system for themselves, they're laying on a mat, they're watching TV, and their animals start gravitating towards them. And it's funny, we normally, rather than getting an update about how they're getting on and how their symptoms are, we get pictures of their animals, and they didn't buy a system for their animal. It's like, oh, look, my dog loves it. He's coming up and, actually he's walking around better. And I'm like, yeah, well, how are you doing?
Exactly. But they do better if the animal they love feels better too. It's really interesting how animals can relate to it. They feel it differently, I'm convinced.
And let's break down an example of like working with horses. Should different parts of the body, for example, like the body versus the hoof, should they be treated at different intensities? And if so, why? Because, you've got all these different applicators, different intensities, different settings. Is there a bit of a protocol when it comes to different areas of the body?
Yeah, absolutely. So lower settings on any soft tissue, you start lower, you slowly move up. When you start seeing movement or areas of sensitivity, that's good. You can turn it down. You don't have to see those, but you want the animal to be comfortable. We look a lot at the eyes and the ears, and we teach this in the education. So what's interesting is horses take less magnetic field than humans. So a lot of times people think, oh, well, I'm going to get this giant machine. Physically on the soft tissue trunk, part of the horse, they take less strength than the NFL players we work with. And that is because the way that they interact with their environment and their magnetic field is different than the way that humans interact with our environment, our magnetic field. So they don't need as much on the physical body. Now, where they do is when you're talking about the hoof and the bone. So you want to penetrate through a cast. You want to penetrate through wrapping. You want to penetrate and maybe pull an abscess out of that hoof. That's where those stronger machines and that range of settings is important. Like having a strength machine that's one setting, there's some out there, but I'm not all for that. I feel like starting low and being able to have that, body intensity that feels good and it works for that animal is great. And then being able to do stronger settings on those hard areas like bones and hooves and, people too. You're not going to feel it in your wrist and your hand the way that you feel it on your back and your stomach, right? Like there is difference based on, how the machine functions. But to me, it's very important to have that range so that especially if you're in business, especially like a lot of people are like, why do I need a bigger machine that has all of these settings? Because when you're in business, you're going to come up with a whole bunch of different things. You're going to have animals who are, more sensitive, animals who are less sensitive. I found it's extremely interesting, Andy, with the fascia in pigs and dogs, the research that we found and the way the fascia responds for pigs and dogs and the neurological function that changes in them. And we have some veterinarians who are doing a study right now, and we're actually presenting that at MagnaCon in June. It's interesting. Like you would love this type, if you're into PEMF, That's the name of your podcast. Obviously you get it. Like, it's cool to see that they actually respond to higher magnetic fields than the horses do. And the results are incredible. So, I guess you want those ranges to deal with anything that pops up.
And are there signs that, somebody's actually using a system on an animal? Are there signs that you encourage people to look out for that a practitioner should respond to? Maybe it's too strong for them. And also, are there any situations where you advise not to use PEMF at all on that animal?
I think just, if I don't think anybody who has no experience with a large animal like horses or bulls should be using this equipment on those animals. I think that the people who you need to have a relationship and understand these animals first before you create a PEMF business. Like, to go out and be like, I have no experience with horses, but I'm going to start a MagnaWave. Don't do that. You know what I mean? Like, go to a barn, volunteer, learn how to be around the horses before you step foot into doing any type of modality on an animal. So I encourage, because when you do that, you know how to tell if a horse is pissed off. You know what I mean? Like, you're going to know if they're uncomfortable or they don't want it. It happens rarely, but sometimes it has to do with fear. I mean, they're prey animals. So it has to do with fear of what is this attachment. So, walking up, introducing yourself, you're a new person, showing them, letting them smell the coils before we go through all of that so that you better understand if this is a fear response or an uncomfortable response. But no, I don't think there isn't a setting or something that I would discourage them. But when it comes to not using the machine, on animals, right? That's what you said. Well, first of all, EPM in horses, I would never say don't use it. But again, let's talk about expectations. Like, when you have EPM in an animal and you are trying to work that out of a horse, that can present in different areas, very much like Lyme disease does. And when that parasite is in the body, if you are doing this, you could move the parasite around, just like running can move the parasite around in the body with blood flow. So you want to know that A, they finish their full course of medication to kill the parasite, and B, that you stick with a very the full treatment plan of like 12 sessions so that you can work that parasite out of the body. But if you go and you do one session, and let's say there was some lameness on one side of the horse has EPM, you do one session, and now the lameness is on the other side of the horse because you're moving that parasite around, they're going to be upset if now you're making it worse. So I think that conversation and knowing the expectations around things like that in Lyme disease is very important. And yeah, pregnancy, I wouldn't work on. We haven't done any studies on pregnancy. I have been pregnant. I've had 3 children. I used the machine on my legs when I was pregnant, because I felt like I could do that for myself, but I would never tell anybody else to do anything with pregnancy on anybody else because, or even an animal, unless it was a life or death situation. Like, I don't think that you should mess with the gift of life and the body's reaction with any modality. If we can't even eat, Subway sandwiches and soft cheeses, then let's not put a modality that hasn't been studied on the body while they're pregnant. So I guess that would be my one that I would, in humans, there's a few that I would be concerned about, but in animals, there isn't much that I would not do. I would try pretty much everything.
Mm-hmm. We often get practitioners saying to us, like with human applications, that they're using PEMF as almost like a diagnostic tool. So, they can use the paddles and they can scan the body and they can find areas of pain. But obviously with humans, you can get them to talk back and communicate. So do you suggest using, PEMF the same way for animals? You can use it as a diagnostic tool, and kind of what are you looking for when the animals are feeding back? Where's the area of pain? Where can you, find those areas, and what would you do with that information?
Okay, so first of all, this is a great question because this is why the veterinary industry at different states in the United States is cracking down. Because if you are a MagnaWave practitioner or a PEMF practitioner of any kind, and you're working with animals and you walk into a barn and somebody says, oh, this horse has laminitis, like a veterinarian says that to them, and then you go in and say, no, my machine is okay, like we're not practicing medicine. We're not diagnosing anything at all. So that has a lot of times these people who have multiple modalities Maybe they have lasers and PMF. It's not necessarily just the PMF, but they're going in and they're recommending not going through with the medications or the surgeries that the medical team has recommended for that animal and trying something else. That's not a good look. Okay. And no veterinarian is going to want that to happen. So first of all, we've teamed up with the AOPP, which is the Association of PMF Professionals. And we have, really want to create like a standard test where we teach people how to speak about this, how to work with their veterinarians. MagnaWave has a mobile app and we actually can, it's got like a picture of a horse, a picture of a pig, a picture of a cat, whatever. You can drop the pins on what we call areas of sensitivity. So that means when you're scanning over the horse, you could see on a low setting on like a 1 or a 2, you're getting movement. If you're getting movement on a 1 or a 2, majority of the time there's some inflammation there and there's some area of sensitivity. So what we encourage our practitioners to do is mark those spots, send through the app. You could send a text or an email to the medical team, to the veterinarian, to the trainer, to the owner and say, this is the area of sensitivity that I've seen. So that they can use that as their diagnostic tool. And we are teammates with them. We are not better than any type of veterinarian or anything. We are not competing with veterinarians. What we are is we're like a X-ray tech, right? Like an X-ray tech knows if your bone is broken, but they don't say that. They mark the areas and they send the reading over to who's reading it, right? Like the doctor who does those type of diagnosis. And that's the way I look at it is this is a tool. It's, that should be part of the whole horse or the whole animal care. You should not be, in any way, shape or form using it diagnostically if you are not a doctor.
Just back to the horses. Serious leg injuries can be life-threatening for horses. So how can PMF help with a horse to recover after a break or a fracture? It's a kind of a big hot topic.
Absolutely. So first of all, PMF can absolutely help. What we have seen is the high intensity PMF penetrating all the way into like the bone marrow. We have done case studies and clinical trials with veterinarians where we've done things like regrown a hoof, which is incredible, where we have actually cut bone healing in half. So what was 8 weeks is 4 weeks. We penetrate through the cast. PMF in the FDA world for humans was considered a class 3 bone stimulator. When I started my FDA journey, that's what PMF was, either a class 3 bone stimulator, which means like you have to be under the care of a doctor to use it. It's prescribed. That's what class 3 means. And then there's also class 1, which is low power, which is just a massager, right? So those were the two classifications. So PMF has been widely recognized as a way to heal bones in animals and people. And I think what's really important to remember is that you're not just working on the area that's injured, that you're working on all 4 legs, because a lot of good horses have died because of things like laminitis or breaks where they were compensating on the other leg, and the healthcare team was so focused on the broken one or the injured one, and they didn't work on any of those other legs for compensation. And then that other leg went down. So if I could give any advice, it would be, work on every leg when you're working on any injury on a horse.